So, Doctor, the concept of having this podcast is all about understanding oral hygiene from an expert like you. So, Doctor, I would first ask you, what is one of the most common mistakes that people do while brushing their teeth or about the oral hygiene?
One of the most common problems that I have seen with patients is brushing too hard. People try to put a lot of pressure while brushing, and that has its side effect. Your gums are very delicate, and when you apply too much pressure, the gums recede. They go down, or if it's the upper teeth, they go up, recession, and this causes a series of chain reaction. So once the gums recede, teeth become sensitive, and then people complain, I'm having sensitivity, and there's a lot of chance of decay because the roots are exposed. So all these lead to a lot of issues.
So the problem starts from brushing your teeth.
Not brushing exactly, but applying too much pressure. And not brushing the correct way. There's a specific direction of brushing, a technique which you can always go to your dentist and ask for help.
Doctor, can you share us some simple yet very effective tip which we can follow at home for a good oral health?
So a few tips that I usually practice myself are brushing regularly twice a day for at least 2 minutes and flossing. No oral health care is complete without flossing. So brushing regularly, flossing, and then there are a few other things that are not directly related to brushing, yet they are very helpful in maintaining your oral hygiene. Staying hydrated, that's very essential. Having a fibrous diet, a healthy diet, avoid sugary drinks and sugary snacks, then visit your dentist regularly. All these, they come as a package. You cannot leave one out and then stay healthy.
Right.
So all these the complete package is essential to maintain a good oral hygiene.
And how often do you think that we should visit a dentist, and why is it so important to have a regular visit?
So it varies from individual to individual. So usually a 6th monthly visit is ideal. So twice in a year is ideal for a person to visit a dentist.
Even if there is no any issues?
Even if there are no issues. And in some individuals, I've seen that they're more prone to decay, or because of their habits, they have gingival gum problems. So they need to visit at least every 4 months. They need to visit the dentist.
Right. So it is individual based.
And then someone who's got excellent oral hygiene and no issues, that only after you visit a dentist you'll come to know, maybe once a year. Then there are some conditions that require you to be monitored by a dentist and be taken care of. Some things that you can't do at home. For example, pregnant women, especially in their 2nd trimester, their gums due to hormonal imbalance, change in your hormones. There are some issues with your gums, swollen gums, bleeding gums. I've seen a lot of pregnant women with these issues, and these women should visit the dentist, especially between their 4th and 6th month, that is their 2nd trimester. Then people with diabetes, because they suffer from dry mouth, which can lead to other issues like caries, patients with gastric problems. So all these people should visit the dentist regularly, at least every 4 months.
So Doctor, I've seen actually when you told about these pregnant ladies or pregnant women, once even after finishing their delivery, they have a lot of dental issues. Is it because of this that during their pregnancy they have not visited a doctor? And because we feel that once you're pregnant, it's better to avoid any kind of treatment procedures or medications. So there is a concept in the mind that you try to avoid going to a dentist or any unnecessary visit to the doctor other than the gynecologist. So what do you think about it? Is it because of because not having a proper care during the pregnancy that they're having issues after delivery and during the breastfeeding?
Yes, I agree with that. And this is a bit off the tangent, but I've seen, especially here in UAE, women are fabulous. They really take care of themselves. So many women who are planning to get pregnant come to us and say, Doctor, please take care of our gums. please do routine healthcare checkups, oral healthcare checkups, and they get it done. And these women then enjoy their pregnancy where oral health is concerned. They don't have any issues. Like there can be issues of bad breath, bleeding gums, pain in teeth, sensitivity, which are completely avoided. And even during breastfeeding and all, these women then enjoy that phase. But in case you've not done that and you are pregnant, then your second trimester is the best time to visit a dentist. Get your complete oral health care done, get your cleaning done, checkups done. Though when you're pregnant, we cannot take x-rays. So at least your routine gum gingival care will be taken care of. Recently, I had a patient in her third trimester, and we generally don't treat patients unless there's an emergency in their third trimester. And she had severe bleeding gums and a lot of pain, and it was very difficult to help her, but yet we did help her very gently. But I hope women can learn and avoid that phase, avoid coming to the dentist by taking care before,
right,
especially in their second trimester.
Doctor, can you elaborate how does pregnancy and post-pregnancy or during the breastfeeding time it affects the oral health?
During pregnancy and post-pregnancy, your hormones are at a very different level than your regular non-pregnant female. So what happens here is it creates havoc on your gums, and pregnant women, they usually suffer from xerostomia, that is dryness of the mouth. And post-pregnancy, most women are busy taking care of their kids, and they don't take care of their diet, nutritional health, they don't stay hydrated. So then these factors come into effect where they have gingivitis, that is swollen and bleeding gums. Their mouth is sensitive. Because of dry mouth, it's painful. They don't stay hydrated enough. And lack of proper diet will again, it's a chain reaction. The teeth, they become more prone to decay then. So this is the phase that is post-pregnancy. Again, that they need a dentist to take care of them, to get their cleaning done, to check all the teeth, avoid sugary drinks, have proper meals. So post-pregnancy, it's very essential that they visit the dentist, get their cleaning done, get their teeth checked, avoid sugary drinks, stay hydrated. By hydration, I mean drink water. It's 0 calories almost. It's very good for health. Have proper meals, that is fiber-packed meals. Avoid sugary snacks, sugary drinks, because they have a very important role in decay. They promote decay, and these women, they are more prone to decay at this phase. So it's very essential to avoid these things.
So doctor, you suggest that having a dental visit during the pregnancy, especially the first trimester, and after the delivery is also very essential.
Second trimester and post-pregnancy. I would highly recommend pre-pregnancy checkup and oral hygiene care. During pregnancy, second trimester is the best phase. Visit your dentist, get your cleaning done, take care of yourself. Your hydration levels should be really at their topmost level. Diet, topmost. Post-pregnancy, again the same routine, and you're good to go. You're healthy and happy.
Doctor, one common myth you would really like to debunk?
This is a tough one. Many patients ask me, why should we come to you for whitening? I'm already using a toothpaste that whitens my teeth.
Okay.
So the myth is that if I use a whitening toothpaste, my teeth will naturally become whiter. Well, why I say that it is a myth is because the color of your teeth, there are two types of stains. One is external, something that you acquire due to your habits, like drinking too much coffee or tea or colored drinks. And the second one is inside, intrinsic, that is due to genetics, that is the color of your dentine, which is usually protected by enamel. So what you see is a slight shade with the enamel, but over a period of time, with age, it wears down, so your teeth become more brown or yellow. Toothpaste can remove the external stains, that is the coffee, tea stains, to a certain extent. You would need your dentist, of course, but the internal stains cannot be removed by your toothpaste. So you would need to visit your dentist or use over-the-counter kits for whitening your teeth.
Coming to coffee, does tea or coffee really affect your teeth health or oral health?
To a certain extent, it does. Why? There are two reasons. Number one, which is an important reason, is if you are having sugar with your coffee. So I feel it's like a sugary drink and you're sipping it over a prolonged period of time. So your teeth are being subjected to sugar. It leads to decay as well. And the most important reason that patients now normally look at is aesthetics. It does tend to stain your teeth. So once you drink your coffee, there's a bit of staining on the teeth if it's very frequent.
So you prefer the patients, whoever is having a coffee habit or frequent coffee drinking habit?
There's a trick to this also. If you're having tea or coffee, number one, try to avoid sugar in it. And if you can't, then also it's okay. Don't have it regularly. And after you have it, I know you are in a workplace, in an office, you cannot go rinse your mouth every time.
Okay.
So keep some water with you, preferably warm water, and sip water after your coffee. And you'll never have a stain there.
Doctor, is sugar-free gums beneficial for your teeth, or it's just a myth?
Sugar-free chewing gum is beneficial in many ways. So most sugar-free gums have some kind of menthol or mint. So it freshens the mouth. It gives you a sense of fresh breath. Secondly, it's very important for facial muscle exercise. So when you chew, your muscles are being used. There's a form of exercise there. So it's very good. And number three, any food that is stuck is removed. And there's a stimulation of saliva. So your mouth is never dry. So for me, that is a very important reason. It stimulates saliva.
And because the saliva is enough, the mouth doesn't get dry
and it prevents decay. It prevents so many other things.
Doctor, we do have a habit of frequent snacking. When you're in a corporate event or office or anywhere, workplace especially, there's always a lot of snacks on the table, and then we often have coffee and snacks. Coming to sugary snacks and sugary drinks, what would you recommend? Is it the sugary snacks is better or the sugary drinks? If at all we have to choose.
If at all we have to choose, it's a difficult question. Sugary drinks are actually more harmful. Why? Because they linger more in your mouth. And because it's a liquid, you tend to have more, so quantity. So your teeth are subjected to sugar for a longer duration of time. There are many people I know who constantly, take a cup of coffee with sugar and they sip tea or coffee. So again, your teeth are subjected to sugar for a longer duration. Yeah. So that causes decay. Sugary snacks, on the other hand, it again depends on what type of snack. You just have it and you're done. But then again, people, if you continuously over a period of time, like say maybe after an hour you have another sugary snack, it's as harmful as a sugary drink. And then if you have like a sugary snack which is sticky, that's like a toffee date pudding or something like that sticks to your tooth, that is more harmful again. But overall, I think sugary drinks are more harmful.
Doctor, how can maintaining a good oral health positively impact on the overall wellness?
Oral health has always been undervalued. It's our gateway to the body. So, number one, in digestion. Having a good oral hygiene aids in good digestion. Number two, pregnancy. Gum disease, especially periodontitis, has been linked with preterm birth and low birth weight. Number three, heart disease. Research suggests that periodontitis has been linked with risk of heart disease. And then your overall mental well-being. If you have gum disease, you will have bad breath. Imagine walking into a room, talking to someone, and that person stepping back. It kills your confidence there. And with periodontitis, if you lose teeth, again, you are not in good mental health. You cannot chew properly. You will have other issues like TMJ problems. So it really affects your overall well-being. In people with diabetes, it's difficult to control your blood sugar levels. Having a good oral health helps with that. So overall, having a good oral health really helps your sense of well-being.
Doctor, I'll go with a set of few questions which is very frequently asked to me as a doctor, and even sometimes even ask my doctors, my dentist. So I'll just put in few questions. Flossing, is it essential or overrated?
It's highly essential. And why? Because there are certain areas in between your teeth that your toothbrush cannot reach. Flossing removes food from there. It then prevents bad breath. It removes all the bacteria as well. So promotes gum health. It's very essential.
How often should we replace our toothbrush?
So every 3 months.
Every 3 months.
No more, no less.
Okay. What's the worst for your teeth? Sugary snacks or sugary drinks?
Sugary drinks.
Now we know there's a lot of people using electric toothbrush. What do you think? Electric toothbrush or the manual one is better?
Electric toothbrush any time. Why? It's tradition meets innovation. So you have the regular toothbrush cleaning your teeth, but with the right pressure and right technique. So electric all the way.
Okay. Is mouthwash necessary for everyone or no?
It's not necessary for everyone. There are some preconditions.
What's the best way to deal with the bad breath?
So best way is to have a good oral hygiene and stay hydrated, good diet, and have regular routine dental checkups.
What's the most underrated habit for a good oral hygiene?
Not flossing.
Being a doctor, what's one thing that makes you really happy about?
Being able to make someone smile with confidence, especially when someone comes with pain and they leave my clinic with a big smile, it gives me a sense of satisfaction.
Thanks a lot for your lot of insights about dental health. It was a wonderful session, honestly. We have debunked a lot of myths. We spoke about a lot of really required topics which people doesn't know, not even spoken, not even advised. So thank you so much, Dr. Moulshree, for having us and having this podcast. Thank you so much.
My pleasure. It was a pleasure having the podcast with you.
Thank you.